Assalamu alaikum dear doctors. In this video I am discussing a video station. So first we will watch the video, then I will discuss what type of question we are expecting from this video station. First question is that what I observe in this video, and the task is that 3-year-old child with seizure. So I can see a 3-year-old child who is average for his age. He is smiley, well grown, and there is no any device attached. The child is not any distressed. Also on my observation I have seen that is a facial nevus, port 1 stain in the distribution of the trigeminal nerve, and it is ipsilateral glaucoma, contralateral hemipharesis, that is hemangioma of the meninges. So this is the presentation, and the history, what history will ask, that is developmental history, ADHD history, school performance, that is epilepsy present or not, and all the rash history like onset, course and durations, any other body part affected or not. Seizure history will ask, child behavior, development history, these are will ask, family history, similar conditions, these are. So what are the differential diagnoses? It can be port 1 stain, it can be Sturge-Weaver syndrome, it can be Klippel-Trenaunay-Weaver syndrome, and Beckwith-Whiteman syndrome. What investigation we do? Imaging, we do the MRI brain with contrast, we find skull X-ray, tram tract calcifications, and fundoscopy. Others are EEG. What complications can be occur? That is coloboma, retinal detachment. Management, we involve the multidisciplinary team, that is pediatrician, neurologist, neurosurgery, ophthalmology, psychology, psychotherapy, plastic, salt, that is speech and language therapy, and occupational. Hemangioma, that is camouflage cream, pulsed dye laser, PDL. Seizures, we give the carbamazepine, and glaucoma, we give the ophthalmology. So Sturge-Weaver syndrome, in shortly, there is hemiplegia in one side and port 1 stain in the other side. Investigation we do as any case of hemiplegia, but here we add X-ray skull for tram track, MRI with contrast for hemangioma of the meninges, and EEG for seizure. Management, we know that number 1, anticonvulsant, number 2, sometimes the seizures are refractory to treatment, so we have to involve neurosurgery for lobectomy, number 3, ophthalmologist for treatment of glaucoma, and number 4, plastic surgery for treatment with pulse laser. Another, it can be port 1 stain, that is a red or purple mark on the eye, and what history will ask, that is onset, course and duration, what make it better, what make it worse. The distribution, usually one side of the face, but can be affected by both. Is it present from birth or not, we'll ask. Is there associated with any abnormal movement? What examination we do? Examine the mark neurological examination assessment, examine the arm and legs for extra growth, and Klippel-Trenaunay syndrome. Do the eye examination for glaucoma, and DD already we know that port 1 stain, Sturge-Weaver syndrome, and Klippel-Trenaunay syndrome. So treatment is that pulse laser. We learned more about cosmetic camouflage makeup. It used to cover the mark, especially in events like parties. Okay. Long-term effect of port 1 stain is that it can help pyogenic granuloma or soft tissue hypertrophy. These are the complications. Also, psychological depression can be developed. We involve the multidisciplinary team for the treatment, dermatologist, laser specialist, orthopedic and vascular surgeon. Video station, a recall question is that Sturge-Weaver syndrome, they show that 12-month port 1 stain, Sturge-Weaver with tracheostomy and respiratory distress, where the differential diagnosis was bronchiolitis, pneumonia, aspiration, pneumonia, viral induced wheeze, and management of the distress. So here I discuss Sturge-Weaver syndrome. Another video will do tracheostomy and the other respiratory distress cause. Thank you. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury.